This is part 2 of chapter 25 in the peripheral nervous system. So we're going to talk about infections and inflammation of the peripheral nervous system. We're going to start with Guillain-Barré. This is caused by a viral bacterial infection, or it can actually occur from vaccinations, specifically the flu vaccine. It is an inflammatory response of the peripheral nervous system. Symptoms include a progressive loss of motor control and sensation that is going to be seen symmetrically. Most cases, symptoms will resolve within a few weeks, about 2 to 4 weeks. Post-polio syndrome. So you may not see as many polio patients anymore. However, you may see some older individuals that have been living with impairments for a very long time. But polio, this was a viral infection that caused paralysis in some patients. So again, people will have residual effects from that initial acute infection. And those residual effects include muscle denervation. So you're going to see a lot of weakness in these patients. They may have joint pain, fatigue, and decreased endurance. The herpes zoster, or else the chickenpox virus, as adults we're going to see this as shingles. So this is when that virus remains dormant, and we said previously if this flares up, we're typically going to see this affect a specific level in the spinal cord, and those symptoms are going to be present in a dermatomal pattern. Infections that will involve the trigeminal nerve. So again, this will be a disorder of the fifth cranial nerve, that trigeminal nerve. And this can be caused by a vascular lesion, so it's going to affect blood supply. It can occur from a tumor, it can occur from a plaque in a patient with MS. Regardless, it's going to affect that trigeminal nerve. The symptoms that your patients are going to report will include sharp pain around their temporomandibular joint. They may report pain with chewing and pain with smiling. Your HIV patients, particularly with advanced disease, will report peripheral neuropathies. This can occur from the disease itself or as a side effect from the drug treatment. Their symptoms will be distal, and they will be symmetrical patterns, symmetrical neuropathies. They will often be painful, and they're most common in the lower extremities. Vasculitis is going to be inflammation and necrosis of the blood vessel walls. This can be caused by an autoimmune response, an infection, exposure to a drug or a toxin. Symptoms that these patients are going to report include pain, burning, and weakness. Myasthenia gravis. This is an autoimmune disorder that affects the neuromuscular junction of a muscle. This is because there is a lack of acetylcholine receptors at that neuromuscular junction. The cause is really unknown. However, they suspect an imbalance of neurotransmitters coming from the thymus. The clinical manifestations that we are going to observe include muscle weakness, fatigability, and this is going to increase with activity. So a lot of these patients, if we push them too hard, they're going to be fatigued very easily and often will not be able to participate in rehab. About 85% of these patients, the weakness is going to be kind of generalized, and it's going to affect the limbs. It can also affect the face and the eyes, however. So oftentimes patients may report to you that they have increased fatigue with simply eating and smiling and talking. The prognosis for this is going to be variable because it's going to depend on what muscles are involved with weakness. So the implications for us as PTAs, we are going to work with them on energy conservation with all of their functional activities. We may need to monitor their chewing, swallowing, and breathing if facial muscles are involved. And again, that may be something that a speech or respiratory therapist may also assist with. The last disorder in the peripheral nervous system that we're going to talk about is called complex regional pain syndrome, or CRPS. It is often also referred to as RSD, or reflex sympathetic dystrophy, or causalgia. We will talk about this in more detail in Therex 2 and in special topics, but I did want to introduce it now. There are two different types of CRPS. CRPS type 1, which tends to be related to trauma, and it is more of a non-nerve type tissue. Your CRPS type 2 is specific to a nerve injury. Their symptoms typically include pain that is out of proportion for what is typical for that injury, and also reporting pain from a non-painful stimuli. So this could be something as simple as putting on socks or the bed sheets rubbing on someone's foot or leg, depending on the area that is involved. Causes for this are going to include trauma, surgery, burns, immobilization, and fracture. These are going to be the most common causes of the development of CRPS. So again, those common causes are going to be trauma, surgery, burns, immobilization, and fracture. You can also see this in patients with CVA, MI, or OA. Our treatment goals are to desensitize the area. That is because, again, they are hypersensitive to a lot of responses, to a lot of contact. So one of the ways that we can desensitize this area is through a contrast bath. So working on tolerance to different temperatures, so alternating between a hot and a cold bath. We can also work on tolerance to different textures and contact with the skin. So oftentimes we might use a tissue or a towel and rub very lightly on the area that is involved and try to improve their tolerance to